Dr. Keila Rodriguez, a general pediatrician and assistant professor in the Department of Pediatrics at UT RGV. I see patients at the UT Health Pediatric Specialty Clinic in Edinburgh, and today we will be talking about tips for the virtual return to school we'll be having this fall. Yes, you should prepare a schedule for your kids as if they were at school. It's really helpful for kids to keep their day just as structured as possible. Throughout this, we're having kids report a lot of stress and anxiety, and these can present as, behavioral problems, and they can manifest in many, many ways. So if you're able to just sit down with them, keep your schedule in mind and your hours and your partners, as well as their schoolwork, then just go through a daily schedule and hang it on the fridge somewhere where they can see it every day. My samples, a lot of parents have asked about this, and my samples are usually, wake up at a regular time. Don't let your kids sleep in every day, because then they'll start getting used to that. But eat breakfast and start classes at the time that you usually would. You can schedule in your snack and play breaks, your lunch, your afternoon classes, and then same with homework and dinner. And that'll just help them stay on a routine. So yes, breaks are so important for children. We can't all just learn for long periods of time, stare at a screen in this case for long periods of time, or read a book for long periods of time. And of course, the age of your child is going to make a big difference determining what the length will be of the break that they need. So if you have a younger child, they're going to need maybe about a 10-minute break between every 20 to 30 minutes. And in that break, they can jump and run around and play, and then they'll come back for the next 20 to 30 minutes of learning. Older children, teens, will be able to focus for longer periods of time. So they might be able to even go up to an hour between breaks. So they can go from subject to subject every hour and then have short breaks in between. Sure, so it's really hard to explain the situation to your kids depending on their age again. All of this advice really, the main caveat is the age and developmental level of your child, but one way that you can explain the situation is by telling them in simple words, if they're younger children, that people are getting sick. Really, really important as you go through your description of what's going on to stay calm. So kids will always interpret your body language. Even if you think they might be a little too young for that, they definitely can pick up on your fear. So stay really calm, try to remind them that you love them and that you're there for them. That's going to be really important. Reassure them that they're safe. So they may be hearing all these things about coronavirus and people going to the hospitals. They may think that they're next or their family is next. They may be worried about their parents or their grandparents. And it's really important to remind them that you're doing everything you can to keep them safe. And that's why we're not going out to parties, things like that. So try to reinforce that level of security that kids really need to feel nurtured. And of course, there's lots of books out there. People are starting to put out books about how to talk to your child, about parenting, and throughout all of this, and going to those resources is always good. I have a list of good resources that I could give patients, and if anybody's interested, let me know and I can send them out to you. Things like the CDC websites and the AAP websites are really good and helpful. I think, of course, the recommendation is still not to go out. So we don't want you out and about, at the mall or at parties. So definitely so important to limit your outings. But if something were to happen, it's good to have your mask at home. So what I've been telling families is make sure you have a mask for every member of your family. If you're going out all of a sudden because of an emergency that was unforeseen, you have to make sure that your child or yourself, that all of the family is protected. I know we've been also bringing our masks along when we go on walks because if we come across a group of people that maybe don't have their mouth or nose covered, then, we put them on. And anytime really that you're interacting with large groups, you should be masked to limit your exposure. The other thing is, of course, if for some unforeseen reason you've got to go out, have your hand sanitizer because you want to make sure you limit how many, germs you bring home with you or into your car. I think a few other things would be a thermometer. A lot of people maybe don't have a thermometer right now that's functioning, and especially with the pandemic, they got a little scarce in the last few weeks. So if you find a thermometer, definitely keep one at home for everybody to use. So making this a better time for your kids should be something that we're all thinking about. Of course, we're all stressed, but if you can talk to your child, just remind them that you love them, that you're there for them, that you're their parent and you're not going to abandon them, is so important. It just sets up this nurturing environment that they can really thrive in. Of course, we're just trying to get through this unprecedented time day by day. So the other important thing is to take care of yourself. If you take care of yourself as a parent, you automatically make this a better time for your kids. Because if you don't take care of yourself, your kids are going to be left in limbo, in a emotional situation where they feel they have no support. So really take care of yourself. Take your own time. I know I have a 2-year-old toddler, and we have instituted alone time at my house. We each take 30 minutes to an hour where we relax and we kind of disconnect, and that gets us so much more ready to be present in the moment with my child when we come back. So that's really, really important, and all of these things can help make this time better for your children. Well, thank you so much for watching this segment today. I hope you appreciated some of the tips that we mentioned. Make sure to check the description on this post for the resource list that I mentioned during the interview. And really important to make sure to call the office, make your appointment, come in for your well checks and vaccines. Thank you so much, and you have a good day.